Hello guys, welcome back to my channel. If you don't know me, my name is Dr. PADIMA and I am currently doing my internship in Tanzania. My medical internship, that is. And I hope you guys have been good. It's been a long time and yeah, things have been happening. Life has been kind of hard, but yeah, we move, as I always say. So today I'm going to be sharing one of my favorite rotation during my internship, and that rotation is anesthesiology. Anaesthesiology has been weirdly nice. I didn't anticipate it to be this nice. I just thought it was going to be a little bit boring, but I actually enjoyed it. Like, you get to learn so much and get to know that so much happens behind the table. It's not just about putting a patient to sleep. So how will my day go about when I was in anesthesiology? Firstly, I'll wake up in the morning, go to work as usual, go to the morning report, of which they will be giving out what happened throughout the night. And one of the nice things I love about anesthesia is that I don't have to be presenting any patients throughout the night. Part of the morning report, I prefer to just go through the theatre list. We use online system rather. And once I go on the system, I get to check like, okay, so this patient is going for urethroplasty. What do they need? Are they going to need general anesthesia? Are they going to need spinal anesthesia? What are they going to need? Is it going to be a cesarean section? I get to know all the details, and then I get into theatre. We usually have like 6 theatres. Out of those 6 theatres, 3 are upstairs and 3 are downstairs. So depending on which theatre I'm in, I'll go to that theatre, change into my scrubs, rather the theatre scrubs. Once I've changed into my theatre scrubs, I'll go to the tea room and I'll order myself a breakfast. Or I order myself a breakfast first, then I go to theatre. Depending on the day. Some days I get to do the latter. So yeah, that will be my day. I wait for the patients to enter theatre. Once they enter theatre, the job of an intern is basically just to clock the patient. You re-clock the patient when they enter. You ask them what's your name, get a little bit familiar with the patient so that they don't feel like, I'm going for an operation, all anxious and stuff. You calm them down, ask them who they are, ask them what procedure they're here for, ask them if they understand the procedure. If they don't understand it, you can do the courtesy of explaining the procedure to them, ask them about their family, get acquainted with the patient. And then once you're done with that, most importantly, know the allergies and the last meal in case it's an emergency. And if there's any comorbidities like hypertension, diabetes, those things you get to know, you need to know those things before going to put the patient on the table. So once you're done with that, you take the patient into theatre and say, for example, if it's a cesarean section, I like cesarean sections because I'm into gynae and all. So if it's a cesarean section, you're gonna place the patient on the table, prepare the patient. I'm going to put an illustration on how we do a spinal anesthesia for those who are interested.
In the case of spinal anesthesia, a single injection of the anesthetic agent administered into the dura mater and CSF through the skin and spinous processes between the lumbar vertebrae, usually at the level of the second lumbar vertebrae or lower. The effect of the anesthetic agent begins almost immediately after the injection into the dural space.
Once the patient is on spinal anesthesia, we monitor the vitals, catheter should be in, everything should be on check. Then operation continues. As they always tell us, make sure that the patient is comfortable, the patient is sleeping, and the patient doesn't get to remember the pain that they endured through the operation. And then you continue monitoring the patient throughout the procedure. And if it's a short procedure, usually I consider cesarean section to be a short procedure, like 45 minutes at most, and then without complications, I guess. And then once the procedure is done, take the patient out and take them to the recovery bay. The most important, your job in anesthesia, to make sure that the anesthesiologist has everything that they need, and then you get to also learn how to do the procedure. I got to learn how to do a spinal anesthesia, epidural, caudal anesthesia. I learned how to intubate a patient for general anesthesia. I got to learn a lot of things. I got to understand the mechanisms of what happens when you put a patient to sleep. What do you have to monitor? The BPs, when they go up, what are you supposed to do? When they go down, what are you supposed to do? When the different complications that can occur during the operation on the anesthesia side, and the complications that can happen. For example, some people get to experience headache, severe headache, like after a couple of hours post spinal anesthesia. How are you going to help those people? Those kind of things. So you get to learn, and I got to appreciate working with the anesthesiologist and the anesthesiology team, the anesthetists and the scrub nurses in theatre. They made my love for anesthesia to be existent because it was never there. So thank you to that team. And my rotation for anesthesia was 1 month, and through that one month I can bet I learned a lot. If I'm in the peripheries and a patient comes in and it's an emergency and I have to do a spinal anesthesia because it's a seizure or a procedure that needs a spinal anesthesia, I think I'm more than capable to do that. And if you're doing general anesthesia, there are a lot of parameters, but I think I can handle it regardless that we have all the equipments that are needed. Thank you guys for watching this video. Hope you guys enjoyed my video, and yeah, that has been my rotation in anesthesia. It wasn't a crazy rotation, it wasn't strenuous. It was a time for me to rejuvenate as I go to my next rotation, which is going to be surgery. Wish me luck, and hopefully it is going to be a good one.